Does the snoring itself cause health problems?
Can. They've looked at this long and hard, and people who snore loudly, we think can get a little bit more blockage in these large arteries that supply the majority of the blood to the brain, the carotid arteries in the front of the neck there. So when I see someone who snores, I'm always listening carefully to make sure they don't hear any abnormal sounds there. Snoring can also fragment sleep. So it's sort of a spectrum. Just because you snore doesn't mean you have sleep apnea. But just because you don't have sleep apnea does not mean that your sleep isn't affected by the snoring.
So you can snore loudly enough where it wakes you up.
Yeah, untreated allergy by itself can fragment your sleep and is a big cause of daytime sleepiness.
How does a person know if they snore? I've never heard myself snore.
Usually an external partner, somebody. So our biggest referrals are family. Someone goes into a medical facility for a procedure and the medical team. Sometimes the patient's the last to know. I mean, they may or may not have complaints about the way they sleep, the way they feel, but usually when you ask them why they're in front of me, they're pointing to somebody else.
Do men snore more than women, or is it about the same? What's the deal
Yeah,
there?
men a little bit more. Probably about 4 out of every 10 men will snore, maybe 2, 3 out of every woman. Kids can snore too, a little bit less frequency there too. But snoring and sleep apnea often is a little bit more male predominant until menopause, and then women start to catch up. There's a bit of a hormone influence here, and sort of towards the latter part of your life, the women and the men are kind of equal.